Everyone, I'm Chip Partner, Assistant VP for Communications at the University of Rochester Medical Center. Many hospitals during the COVID pandemic halted non-essential surgeries, including transplants, during the height of the pandemic. At UR Medicine, our transplant teams were able to continue providing life-saving transplantation for our patients in an environment that ensured safety for patients and staff. And in fact, over the past 9 weeks, there have been 17 liver transplants, 7 kidney transplants, and 3 heart transplants. Of particular note, UR Medicine performed its 1,800th liver transplantation surgery in late March. This is a milestone for the liver program, which started in 1992. Joining us in our studio to share more about this are Dr. Roberto Hernandez Alejandro, Chief Solid Organ Transplant Surgery on the left, and Dr. Sunil Prasad, Chief of Cardiac Surgery on the right. And from their homes, we hoped to welcome 2 transplant recipients today who recently underwent their life-saving surgeries. Liver transplant Thomas Stevens in Syracuse, who had a successful liver transplant on March 31st, unfortunately had a last-minute conflict and could not join us. But Mr. Frank Rzyński in Greece, New York, received a new heart on April 28th, and we are so delighted that Mr. Rzyński can join us today. Before we open it up for media questions, Dr. Hernandez, we wanted to ask if you wanted to say a few words.
Thank you very much. I think it's very clear that during the pandemic, there was a need for closing for elective surgeries. Our institution, same as other medical institutions, and that was the safest things for patients to close because of the pandemic. However, knowing that transplantation is a life-saving procedure, we decided to keep it open and try to be the highest care that we can bring to these patients. As it was mentioned, we have done several liver transplants. Yesterday, we increased it to 18. And tonight, we're going to be doing number 19 during this pandemic, as well with 7 kidneys and 3 heart transplants as well. This has been done with the support from the institution for protecting our patients and continue providing life-saving procedures for them.
Thank you very much. See, we've got people from all of our TV stations on the line, but I'm not sure what reporters are on the line. If you can unmute Corey Channel 10. Is there anyone on the line from WTC Channel 10? Any reporters from Channel 10? Nope. How about 13 William TV? Do we have a reporter on the line? Next up was Spectrum News to sign up, and Mary McCombs. I see that you are on the line from Spectrum.
Yes, I am. Hi, how are you?
Good, thanks, Mary.
Can I ask a question, or are we going to wait?
Go ahead.
I'm sorry?
Yeah, please go ahead.
Okay, great. I've interviewed Dr. Alejandro a little ways back. I'm not sure if you recall the case with the South Carolina firefighter who donated his, I believe it was liver. Yeah.
And you went out and had a garbage plate and got a tattoo.
Yes. Yes.
That's correct.
Yes, and I interviewed you, so I it's good to see you again. And we had a short conversation. You mentioned you were in Canada prior to this, correct?
That's correct.
Yes, good to see you.
Thank you. Nice to.
Yeah, I guess my first question is, we did hear a lot about how a lot of things were on hold during this, and obviously that was not the case, which was great. But talk a little bit about how you prioritized in terms of, did you have to look at, who was in need in terms of, patients that you were dealing with the last couple of weeks as far as organ transplants?
That's correct. I think we have been practically 9 weeks during this period of time that we put on hold all the elective surgery. And regarding transplantation, specifically in my area, liver and kidney, Dr. Prasad talked about heart. We were cautious with some organs, looking at the needs and the emergency situation or urgency that the patient needed. So that was the way that we were building with a multidisciplinary team the decision of whether a patient should be placed on some risk of COVID versus transplantation. But if we look at these measures really the need of a liver transplant or sometimes of a kidney transplant, it's higher than the risk of COVID. We have been fortunately to have very good outcomes with all the multiple transplants that we have been doing with the care that we have been providing. However, you mentioned about life donation. Life donation is a very important thing because it's not about the recipient, it's also about the donor. And this is someone who's donating part of their liver or a kidney, and it's a healthy person that is going to give it to someone who's sick. So we have to be cautious with this, and we put on hold both programs in life donation, liver and kidney. And it was completely understandable despite some of the patients wanted to move forward. And after looking at our outcomes with COVID in our county and our hospitals, the numbers has been decreasing significantly over the last weeks. We have been very successful with the admissions of COVID patients or ICU patients with COVID, and we have been also isolated those patients. Therefore, we have COVID-free areas, and we're able to provide nowadays. Again, we reopened the live donor liver transplant program and the live donor kidney program. Today, we're right now a kidney transplant from live donation. In June, we'll be doing a couple of livers. So we're moving forward with these now.
How inspirational is it? I mean, obviously, we're seeing, you know, a number of deaths recorded daily here in Monroe County regarding COVID, but yet to be on the other end of it where you're trying to give new life, a new lease on life for people. Talk a little bit about that dynamic. And
so when Sunil, you can talk about some of the heart experience.
Sure. So, you know, as Dr. Hernandez was saying, the patients that are on waiting lists for organ donations don't have the luxury of time. And that's one thing with the COVID era here is that it has, by using social distancing, has increased the time for the virus to have its clinical effect. That means that we're spreading the virus over time so that we don't overwhelm our healthcare system. Unfortunately, patients on the transplant list, whether they're liver or kidney or heart, have a certain amount on the time before their organs start failing. And so it's very important for transplant programs, whether they're cardiac or liver or kidney, to be sure that we are taking these risks that the patients have on the list, balanced with the COVID time. And so we've been able to continue the transplant program for hearts for that need. The patients that have had heart transplants were very sick. And so regardless of COVID or not, their expected survival without the arrow would be very poor without a transplant. So you're at a point where you have to do the safest operation possible, take all the precautions for COVID, but then still take care of the patient's needs. One of the things that we've had in heart surgery that we're trying to get out with the community is that a lot more people passing away at home because they're not coming to the hospital. And what we're seeing in the heart world is that patients that have acute heart attacks. We know the prevalence of that in the community, whether it's Rochester or if it's Maine or if it's Florida or California. That has dropped a lot of those patients coming into the hospital to seek care for chest pain or shortness of breath. And what we found, especially in Monroe County, is that the mortality at home with those calls has gone up. And so it's very important in the COVID period that patients that are sick still seek help.
Thank you, Dr. Prasad. Mary, I think you may be the only reporter on the line today, so I'm going to, I have a couple questions I wanted to ask, but if you
sure.
ask questions of Mr. Brzezinski about his experience and other questions of the doctors, you can kind of make this a one-on-one interview, just knowing that your colleagues at other stations are rolling on it. One that maybe I'll ask Dr. Hernandez first, but either doctor to comment on. We know that a lot of patients are concerned, even for a serious operation like transplant, is it safe for me to come to the hospital? And what steps have we taken to make sure that it is safe when patients have a transplant operation?
Definitely, this is a very important point for our community, patients and family members to know about this situation. Every single person who works in this institution at the University of Rochester, every day it's a screen for symptoms of COVID. Every day we need to reply for screening questions about that. Second, we use the adequate protective equipment. For this, wearing masks with hand sanitizers, trying to keep distance, social distancing with this. And if we go to the operating room, all the patients that go to the operating room are tested for COVID. They have to be negative for COVID to go for an operation. We're wearing the adequate PPE for being operating. I would say it's safe to come as a patient. You don't have to wait for coming to the University of Rochester. I personally feel more comfortable and more safe to be in the hospital than being out there going for shopping or trying to go and buy a coffee in a shop. I think it's we're doing pretty well in that aspect for protecting our patients and protecting our all the healthcare workers here.
Dr. Prasad, did you want to add anything to that?
No, I concur with Dr. Hernandez. The hospital is probably one of the safest places to be in the COVID era because everybody is screened, including all the members of the University of Rochester medical system and all the patients. Whereas you could be out, at a store or at a pickup, and you have no idea if that person that was doing anything has a cough or a flu or a cold, where we're screened here and the patients are tested. So I agree that the hospital is probably one of the safest areas because all the testing and screening occurring.
Thank you both. Mary, we can tag team this if you'd like. Do you have some questions either for Mr. Rositsky or for either of our doctors?
Oh, is the patient there?
He's not in the studio. I think we can call him up on screen.
Oh, yeah. Oh, there he is.
Thank you so much for joining us today.
Yeah, great. I'm Mary McCombs from Spectrum News. Congratulations on your new heart. You're almost about 2.5 weeks out, or 2 weeks, or?
I'm sorry, Mr. Rositsky, we had to unmute you. Now we can hear you. Can you say that again, please?
I had my transplant take place on the 28th of April, and I'm doing very, very well considering how close it's been since I had the transplant. Everything has worked out really well for me.
Can you just talk a little bit about what your situation was, your medical history prior to getting the heart, and like how long you had been waiting, and just some background?
February 2018, February 13th, I went to Unity Hospital because I was not feeling well whatsoever. I was having a hard time walking, and stubborn as I am, I drove myself and my wife to the hospital, got out of the car, and I had a hard time walking the 20 feet into the emergency room. I got into the emergency room, and they greeted me with the wheelchair, took me right in, and I was there for 8 hours. During that time, I coded 3 times, and they said that they would have to transfer me to Strong. So I was at Strong at 5 o'clock that day. And from that point onward, they decided to give me a LVAD system. I needed to be stabilized for 7 days before I could get into the LVAD system. And it was touch and go because I coded 3 more times while I was at Strong. It was a long process. And 39 days in the hospital. I had to relearn how to read, write, talk, walk. I felt like a total invalid, but with all the good care that Strong provided me and with the rehab, I was able to walk out of the hospital and start celebrating life. From that point onward, the cardiologist and I from the LVADS team thought it might be a worthwhile try to see if I could become a heart transplant person. Because at that time, you have to go through extensive testing. And I went through like 6 months of testing, all kinds of blood work, right heart catheterization, pulmonology, telemetry, colonoscopy, you name it, I had to go through it. And if I were successful, and was able to meet the criteria and stick to the game plan that they gave me, they said there was a possibility that I might be able to receive a heart. And on April 27th, at 7 o'clock in the evening, I was at our lake house and it was pouring rain. I was checking out the sump pump, and all of a sudden I look at my phone and it says, Heart Transplant Center, a Strong Hospital. I usually never get reception on the lake when it's windy, rainy, and stormy. So I answered the phone, and they said, this is Heart Transplant. We need to speak with you. And the line went dead. And I said, oh my gosh, now what do I do? Because it's the general number, the 756-4800 number. So I went to the edge of the driveway where I get clear reception. 10 minutes later, the call came again and said, can you be in the hospital as quickly as possible? So I got there about 8:30. No one was in the hospital. It was perfect timing. And from that onward, everything is just history and worked out very smoothly for me.
When were you told you would be a candidate? So how long did you wait for this?
Last June of 2019.
Okay.
I finally made the candidate list. Mm-hmm.
Okay. 2019. Okay. And talk a little bit about your new lease on life. I mean, how you plan on spending your time, I guess, now that you've been given this opportunity.
I've always liked outdoor activities. So playing golf and riding a bicycle, going for walks. I used to travel a lot with my family. Hopefully I can resume all those things again and not worry about plugging into a wall at night, recharging batteries continuously. But I have other areas that I have to follow through with, especially taking my pills on an ongoing basis continuously and making sure my diet is correct and plenty of exercise.
I was just going to ask what your protocol is. I mean, obviously you're still doing follow-up treatment and talk a little bit about that.
Well, tomorrow I have to meet for a total evaluation at 8:30. And then after that, sometime before noon, I have to go for a biopsy so that they can check the particles in my heart to see they're functioning properly. On Friday mornings at 7:30, I have to get blood work. Have to repeat everything again next week at the same time. And then in the process, I always have to get coronavirus testing as well.
And your prognosis, I mean, what are doctors telling you?
I'm doing very, very well, especially for my age, especially for the short period of time that I've been there. I met all the nice standards that the department of, what do you call it, the rehab department put me through, physical therapy, and they really enjoyed working with me, and I enjoyed working with them.
3600, adult call team, call unit for 3600.
Sorry, Mr. Rosinski, we got a little page going off in the hospital. Okay.
So I was very pleased to meet those standards, and now I can hopefully look forward to 2 more biopsies after this one, and then go every second week instead of every week for a biopsy.
And how long do they say this heart, I mean, you know, sometimes they give you time period of, you know, did the doctors say anything about that, or?
Yes, first 6 months are the most important time period. That's when usually all the problems take place. If I get through the first 6 months, hopefully I'm well on my way. But, you know, you can't lift anything heavy. You can't do anything extraordinary. So you just take it exactly as they outline it, follow the rules and regulations, take your medications at 6 a.m., 9 a.m., 12 noon, 3 p.m., and 9 p.m. So if you can do all those things, make sure your pills are accurate. Hopefully it'll work out for me.
Mary, if I can jump in. Mr. Rosinski, please don't go away. It's so wonderful of you to share your story. I hope you feel half as good as you look, because you look great. I wanted to ask Dr. Prasad if this is fairly typical of a heart transplant case, or whether this was faster or in terms of matching with an organ, or less so.
It's typical, about 9 months or so. And, it's one of the, as he explained, the whole spectrum of care, when the majority of our patients that we see at the University of Rochester are not from our Rochester area. So only about a third of our patients that come in advanced heart failure, whether they get an artificial heart machine like he did, like an LVAD, or get a heart transplant, only 30% are here. Our reach is very regional. A third come from Buffalo, a third come from about here, and a third come from the Syracuse, Albany-ish area. So that's a very typical thing, is that we take transfers in from most, like I said, about 2/3 of our patients are transfers in from another hospital for a higher level of care. And then they go through a whole process to see what the best fit. Sometimes an artificial heart type procedure, or LVAD, is the right fit to get someone resuscitated out of the hospital so they get stronger, so they can get ready for a transplant. So not untypical.
And Dr. Hernandez, I know you mentioned that in both kidney and liver donations, living donation is an option. How many living donations do you perform, that your team perform typically in a year?
So in live donor kidney transplantation, we're helping and giving a second chance, the gift of a second chance to patients in around 50 to 55 patients per year. And we're glad to know that there's a lot of people interested on being supportive of live donation kidney transplantation. For liver transplantation, last year we did 1 per month. We did 12, and this year our target is to be able to reach 18 for helping patients with this. Of course, during this period of time that we put on the programs on hold, this is going to affect us. But I think the support from the patients, the support from the institution, we're moving forward, and we should be able to catch up. There has been a little bit of concerns from some family members saying, I would like to be with my donor, the family member, during the day of the operation in the hospital. And because there's some restriction for from patients, the family members, to come to the hospital, because we're trying to protect patients and the healthcare workers, we have been working very hard with patients and family members, communicating constantly every day what is happening in the operating room after the operation, communicating and doing FaceTime with them, FaceTiming their patients so they can be able to talk and see them. And this is helping to relieve sometimes the anxiety of these huge operations. But we're very proud of the patients that we have here at the University of Rochester.
Mary, did you have other questions you wanted to ask?
Just one quick question. What was the original diagnosis for the heart patient, Rosinski, Mr. Rosinski? It was his original diagnosis.
Give us just a second here. There we go. Hi, Mr. Rosinski.
Actually, could I have the doctor answer if he doesn't mind? And just like some key things that he has to look out for now. He mentioned first 6 months, and just what his original diagnosis was.
Sure. My assumption from this case is it's a viral cardiomyopathy that led to the heart failure and to the subsequent cardiac arrests.
And what type of things is going to be critical for him in the days and months ahead?
So yeah, as he had said, the first 6 months are the most important parts. It really is. When we do any sort of transplantation, it's like a dating. You take somebody else's heart and you put it into somebody else, and now these two individuals, the heart and the recipient, are now dating. And that's why those biopsies and all those medicines are so important. They're the mediators between this first date. And once that first date goes very well, which in his case it is, then after about 6 months to a year, the maintenance on a transplant is almost negligible. It's like taking a vitamin, and that's about it. So the prognosis is very good during these after those 6 months, but it's a very important time right now. So I would say the important thing for him is to make sure that he stays safe from COVID. And as you go outside and you have the restrictions of wearing a mask and staying 6 feet or more apart, those are probably the biggest things to do outside the hospital. Again, inside the hospital, everybody is screened every single day over and over again, and all the patients are tested. But outside is actually more important to be safe.
Thank you. Thank you very much.
Thank you. Dr. Hernandez, unfortunately, your patient, Thomas Steves, wasn't able to join us today, but are you able to talk briefly about his case and liver transplantation in general?
Yeah, well, our patient developed cirrhosis, and he acquired this. His liver was injured, and these patients start developing a lot of terrible symptoms, and their life it's pretty affected for their quality of life of these patients. They can develop normally bleeding from varices in the stomach. They get very muscle wasted. The patient develop a lot of fluid in their abdomen we call it ascites, and their quality of life it's very detrimental. Therefore, liver transplantation is the only option. We don't have any substitute for liver that can keep them alive. Therefore, it's a priority for them to be transplanted. His transplant went very well. His length of stay in the hospital was around 7 days only after the transplant. So he recovered very quick from a beautiful family who decided to donate part of the organs of a beloved, someone who has brain death. And then we were able to transplant this organ, give the second chance to this patient, and he's doing very well. And as Dr. Prasad mentioned, it's very similar in liver transplantation and kidney transplantation. The initial months are more critical. We want to be sure that there's no rejection. We want to be sure that that organ is functioning well. So there's a very close follow-up for these patients that we have in our clinic, and we also do through telemedicine that we're doing much more nowadays. And we follow these patients very closely, and they are able to have a pretty good prognosis for the several years ahead of their lives. So this was a successful case, as the vast majority of our cases at the University of Rochester.
Thank you so much. Bob Marcotte, did you have a question?
Yes, this is Bob Marcotte with University Communications. I wondered if I could ask Frank a couple more questions.
Yes, Mr. Is it there?
Yes, Frank?
Yes, sir.
This is Bob Marcotte, University Communications. I'm sorry if this was brought up earlier and I missed it, but you're retired?
Yes, sir.
And what did you do before you retired?
I was the school district central office administrator.
For Greece School District?
No, Canandaigua City Schools.
Canandaigua City Schools. One other question I had, did you have any trepidation or misgivings or anything in the back of your mind about, gee, am I going to catch COVID-19 by having to have my transplant at the hospital right in the middle of this pandemic? Was that in the back of your mind at all?
It really wasn't, because I said, this is probably my first and only opportunity. Let's go for it, because I've been waiting a long time for this. And if it's going to work, it's going to work, and I'm going to go with it. If it doesn't work, I'll just accept the consequences and see what happens from there.
And my last question is, and I think this was mentioned earlier, that there's a lot of concern that people who are having heart trouble or other serious conditions are staying away from the hospitals when they should be going, like you did. What would you say to those people?
I would say at least call their PCP and find out what's going on, so that they're not making their own diagnosis. They're coming up with something that's going to be relevant that they can pass on to, the LVAD center or the transplant center or to whomever, because we know a lot about the internet. We know a lot about what's taking place in medical journals. but we don't know everything. We need help as much as we possibly can, and let's rely on the experts that we can count on to hopefully resolve issues as quickly as possible.
Great. Thank you so much, and I wish you all the best.
Thank you very much.
I want to echo that on behalf of Dr. Prasad and Dr. Hernandez and everyone here. Mr. Rosinski, thank you so much for joining us. We hope your path of recovery continues to go as well as it has so far. Thanks for everyone who joined us today, but particularly Dr. Roberto Hernandez Alejandro, our Chief of Solid Organ Transplant Surgery, Dr. Sunil Prasad, the Chief of Cardiac Surgery, and our translators, Will and Chris, and Morgan Underwood from ASL Translation. Delighted to be joined by Karen Christensen and Leslie White today, helping us organize this multi-camera affair, along with Corey White and Jeff Mead running the camera. So thanks all for joining us, and we will end the meeting now.
Thank you.
Thank you very much for